welcome to the second annual Hope Memorial Walk and Resource Fair. Thank you for being here. Hope is a nonprofit organization started here in Pacifica. HOPE stands for Healing, Overdose Prevention, and Education. For those of you who don't know me, my name is Holly Smalley, and it is my honor to be your Master of Ceremonies today. This weekend we are joined by communities throughout the United States, across the globe, marking International Overdose Awareness Day, which is the world's largest campaign to create awareness surrounding drug overdose. My good friends Rondell and Clarence Davis, I'm not sure where the lovelies are at, there we are, hello. They've asked us to share a little bit about their story and what brought us all through today for this very special event. Rondell and Clarence founded HOPE in March 2024 in honor of their son Tyler, who tragically passed away at the age of 30 from fentanyl in May 2023. Their very personal and devastating loss, coupled with profound and powerful love for their son, helped to shape the mission of HOPE, which is to acknowledge and support grieving families and friends impacted by the loss of a loved one, educate the community on how to prevent an opioid overdose, reduce the stigma of substance use disorders, and provide resources for those currently struggling with addiction. Over the past 18 months, HOPE has distributed almost 3,000 units of Narcan, trained high school and college youth on the dangers of fentanyl addiction, tabled at local events including the Fog Fest, Coastside Pride, recovery resource fairs, and local colleges in San Mateo County. HOPE also currently has 4 public Narcan dispensers in Pacifica, including one where I work at LIT, where anyone can come in for free Narcan, no questions asked. I'd like to invite the board members of HOPE to please come up on stage. Rondell and Clarence are supported by an all-volunteer board, which includes Rondell as president, Clarence as co-founder and board member, Brianna Karstead, treasurer, Suzanne Hoff, board member, she's not here, Mary Beard, board member, and Suzanne Rasmussen, secretary. Thank you. Many of you are here today because you have lost a loved one. We are part of the family. We are part of one family bound by tragic loss, and today we will take the time to remember our loved ones, to honor their memory, their hopes and their dreams, their smiles, laughter, their intelligence and creativity, their personal struggles, and their beauty inside and out. We believe that no one should carry grief on their own. Every voice should be heard. Every emotion, whether it's sadness, confusion, anger, or disbelief, should be acknowledged. And every story should be shared. We offer a safe space for you to do that. Some of you are here today because you are parents or educators who are curious and want to learn more about the opioid epidemic and how to recognize if your child or if your student is experimenting with drugs, or to learn about Narcan, a life-saving medicine that reverses the impact of an opioid overdose. Later today, we'll have speakers and personal testimonies here inside the Moose Lodge. There will be 2 presentations on the opioid epidemic, with the Narcan demonstration at noon and again at 2:30. Outside, there's resource tables available all day, and inside the Moose Lodge has an interactive learning experience for adults 18 and up called Hidden in Plain Sight, which stimulates a teenager's bedroom and educates adults on potential risky behaviors. Some of you are here today because you have a family member or friend who is struggling, or maybe you yourself are struggling. We encourage you to reach out and talk to the resources we have available who have expertise in addiction, recovery, and mental health. They're here to help you. Through the memory of Tyler Davis. Through Tyler Davis. Alberto Piedra. I'm reading the list of angels' names. Alessandra Stevens, Amanda Moyer, Angelina Spills, Anthony Christopher Batres, Anthony Terranova, Billy Gary, Bobby Gonzalez, Brandon Ennis, Brandon Hanson, Brianna Elizabeth Orante, Brittany Ann Camus, Bryson Beltran, Casanova Salvatore, Charlotte Taylor Austin, Chloe Vivian, Clemmy Hill Jr., Cyrus T.T. Martin, Devin Roberts, Dominique Ramirez, Elijah Hilton, Eric Joseph Donati, Eric K. Gonzalez, Hannah Spicer, Hayden Royster, Isaiah Boatwright, Jacob Guerrero, Jacob Ashner, James Ray Walker, James Simons, Jason Kyle Kunis, Jaden Urban, Jasmine Pellegrini, Jeffrey David Spiller, Jenna Marie Anderson, John Hawks, Robbie Hawks, John Paul Strong, Joshua Smith, Carrie Monkey Hunt, Kevin E. Barron, Leona Swinney, Merrick Aaron Cole, Matthew Tarrant, Matthew Thompson, McKenna Rosado, Melissa Escobar, Micah William Hamlo Salyer Jr., Michael A. Lamas, Michael Anthony Smith, Michael Newton, Michael Thomas Neck, Miles Van Heusen, Natalie Regeniter, Paxton Hale, Rachel Marie Cecilia West, Ricky Simmons Jr., Robert Sterling, Ryan O'Brien Shuchuk, Samantha Kelsey, Sean Nava, Sebastian Moreno, Tosh Ackerman, Trenton Lawrence, Trevor Leopold, Tristan Shoemake, Tyler Hamilton, Velveeta, Tyler James Davis, Victoria Jones, William Will Arpin II. If I missed a name, please feel free to shout it out.
Stephen Borch.
Andrew Schick.
Joseph
Thank you. Hope will have a lasting impact on saving other young people and preventing their families from experiencing the heartbreak and grief of losing a loved one to an overdose. And today we come together, driven by hope and determination, to educate the community on substance use disorders, overdose awareness and prevention, and to ultimately save lives. The opioid epidemic is shattering not only families, but entire communities. The reality is that drug addiction does not discriminate. Its impact is far-reaching. Each of us knows someone who has been affected. Family, friends, neighbors, coworkers, classmates. It invades all the spaces we share in society. As part of the Hope community, our lives are deeply intertwined as we search for answers and knowledge to end drug abuse and overdose deaths. We are hopeful that by making harm reduction education tools more widely available, we can end the stigma surrounding addiction and eliminate overdose, creating a safer world for all. Thank you for having the courage to be here today. It is now my honor to introduce Susan Beckmeyer, Mayor of Pacifica, to the stage.
Good morning, everyone. Thank you all for being here. Today we come together not just to talk about statistics or policies, but about people. Our neighbors, our families, our friends. We all know someone who's been affected by overdose. Addiction is a disease, not a moral failing. Recovery is possible, and support saves lives. I want to thank you for spreading awareness about fentanyl poisoning. We want our youth to understand the risks and feel empowered to make smart choices. Ending the stigma around substance abuse starts with conversations like this. Compassion is one of our strongest tools. Today I ask each of you to take one step, whether it's learning to use naloxone, sharing a resource, or simply listening without judgment. There's hope, there is healing, and there's help. Together we can build a community where recovery is not only possible, but expected and encouraged and celebrated. Let's make Pacifica not just a beautiful place to live, but a safe and supportive one for everyone.
Thank you, Mayor Beckmeyer. Now I would like to introduce Supervisor Ray Miller from the San Mateo County Board of Supervisors. Supervisor Miller serves the 3rd District, which includes Pacifica and surrounding coastal communities. We want to acknowledge Supervisor Miller, who has been instrumental in advocating for hope. Recently, he spearheaded a grant to expand Hope's Narcan dispenser program throughout our district. Thank you for being here today.
Good morning, everyone. It's a pleasure to be with you this morning. When you listen to that list, you think about the amount of pain that people feel in this room, the people who get lost, and then you realize just what a beautiful day it is. That everyone's taking the memories of those and they're turning that into something of beauty, an investment in the community, helping others, and remembering in that way. And you really are making a huge impact in our community and in our county. To see how Hope is reaching out and helping others and putting these dispensers out to help people, it's a chain reaction. It's something that we look at happening here and it can happen throughout the county. This is discussion that we have to have throughout the county. There are many parents, frankly, in this county who don't understand what you all do. They just don't, but it hasn't hit them yet. It hasn't talked to them yet. They don't understand that danger. And the work that you're doing to help them will save others. The memory of the person you lost will help save all of those who come next. And we are so grateful to you in this moment for stepping forward in that way, for taking that beautiful step forward to help others. And so at the county, I see Noah, can you come up here with me? Supervisor Corzos. We have a resolution that from the Board of Supervisors to honor the work of Hope that we want to go ahead and present to all of you. This is something that is adopted at the Board of Supervisors meeting, goes into history of the county to celebrate the work that you've done. And I already had an opportunity earlier to present this commendation to Rondell and Clarence. But the most important thing I want to leave you all with today from the County of San Mateo is just simply thank you so much.
Good afternoon. Everyone's able to hear me okay? All right. So I really appreciate, obviously, the collaboration with Hope, and I really appreciate the invitation to speak to you today around overdose prevention and the administration of naloxone. Now, for those of you who know me, I can be a little bit ambitious. So I do have a little bit of an ambitious schedule of what I'd like to cover today. But more importantly, I want to make sure that we cover the things that are important to you. So you leave here really feeling knowledgeable and capable and comfortable responding to an individual who might be experiencing an opioid overdose. So we have to always start with the why. So I want to provide for you a little bit of an overview of the overdose epidemic. I then want to describe for you what opioids are, maybe clarify any misconceptions that you may have about opioids, because there are times when they can be used very appropriately, but there are times when they can be used inappropriately. I then want to define for you what an overdose is, and then how you can respond to an overdose involving opioids through the administration of naloxone. And then I want to provide for you the protections that exist as bystanders administering naloxone. That's a question that typically comes up. And then I finally want to end with how you can get involved. During the presentation, feel free to stop, raise your hands, ask me questions. I want this to be really interactive, and I really want us to feel that we are in conversation with one another. So this is your opportunity to flesh out kind of your angst, your concerns, your misgivings around this topic, all right? So let's first talk about kind of like the why. Why are we here? Well, I think we all know that we are in the midst of an overdose epidemic, right? And when we take a look at some national data, this comes from the Centers for Disease Control. In 2023, there were more than 110,000 Americans who lost their lives in a single year from an unintentional overdose. In 2024, the CDC reported about a 27% reduction in overdoses. It went from 110,000 to about 80,000. And it's widely believed that decrease, which is one of the most significant decreases that we've seen since around 2018, was widely due to the distribution and wide availability of naloxone, which we'll talk about today. When we take a look at what's happening here in California, this data comes from a different data set, which is the California Overdose Surveillance Dashboard. And in 2023, there were 7,847 Californians who lost their lives from an overdose involving opioids. Now, when we take a look at who these individuals were, it really spans the entire spectrum of life, from newborns all the way to individuals over the age of 85. So let's take a look at this graph. When we take a look at kind of what's happening, we can see that it starts kind of spiking around the age of 10. Right? And then we see it increasing almost tenfold between 15 to 19 years of age. We see that it continues to climb, almost increases threefold between, I think, 20 to 24. It doubles between 25 to 29, and then it peaks between 30 to 34 years of age. And then it starts to decrease. So we see this period of time from about 15 to about 35, where there's an increased risk for an overdose death. When we take a look at what's happening here in San Mateo County, come on in. In 2023, this is the information that we have, the year that we have the most current information, there were 85 residents of San Mateo County who died from an opioid-involved overdose. There were 158 emergency department visits, and there were 69 hospitalizations. So we talk about kind of like, I would say, our why. We've got more than 80,000 people in this country dying in a single year from overdose. When we think about our why, we're looking at 7,847 Californians, and we're looking at 85 of those here in San Mateo County. So when we have a number that is more or greater than 0, we have to respond, and we have to be active, and we have to be on alert. So that's really the why. Before we can get into how do we administer naloxone, how do we respond to an overdose, I do have to provide for you a little bit of kind of foundation, if you will. So we need to understand what opioids are, and then we need to understand what an overdose is. And then when we have those two pieces of the puzzle, we can then move towards how do we respond to someone who's experiencing an overdose involving opioids. So as many of you may know, opioids are a type of drug that's known as an analgesic. And that's just a fancy word for meaning that it's a drug that helps to alleviate pain. Before I became the senior community health planner, I practiced dentistry for 33 years. And oftentimes, I'm sure everyone's been to a dentist, right? Okay, good answer. Everyone's flossing their teeth every day, right? Okay. Always good to do a little check-in and also push, good oral hygiene. But I'm sure many of you have been to a dentist, right? And you may have had a root canal, you may have had an extraction. And after that procedure, your dentist may have given you a prescription for an opioid, like Vicodin, or Lortab, or Norco. And as a dentist, oftentimes I had to manage my patient's pain that way because I knew after the root canal, or I knew after the extraction, reasonably, that my patients were going to have some degree of pain after the procedure. Now, when an opioid is taken appropriately, it's a very effective drug to alleviate pain. But the problem is that for some individuals, after the pain is gone, they continue to take the opioid. Because the opioid, in addition to alleviating pain, it also indirectly triggers the release of a chemical in our brain called dopamine. And that chemical produces a feeling of pleasure. And so long after the pain is gone, the patient might continue to take the opioid because it's producing pleasure. And with continual misuse of the opioid, they start to develop a tolerance to the drug. So now it takes more and more of the opioid to alleviate pain, but it also takes more and more of the opioid to produce pleasure. Now, in addition to opioids being, manufactured by a pharmaceutical company and being prescribed by dentists or physicians, the illicit drug industry has also learned how to manufacture opioids, and we'll talk about that in a little bit. So, an individual exposure can come from a prescription. An individual exposure can also come through illicit drug means. Does that make sense? Okay. Now, there's three main effects of opioids. Okay, there's a physical effect, there's a behavioral effect, and there also is a mental health effect. Okay, so physically, as I shared with you, opioids alleviate pain. But the other thing that happens when someone takes an opioid is that it's going to make the individual feel really drowsy. If you've ever looked at the prescription bottle saying, do not operate a moving vehicle, because it's a sedative. It also causes, which is the most significant negative physical effect of an opioid, it will cause someone's breathing to slow down or stop. And that's what actually causes an overdose. The second main bucket of effect of opioids is a behavioral effect. So as I shared with you, opioids will cause a feeling of pleasure. They will make the individual feel pretty euphoric. And that's through that chemical release of dopamine. But it also can cause individuals to begin to become isolated, where they start to retreat from their personal and professional obligations. They kind of start to move away from their friends and their family. And they also have difficulty maintaining obligations, their work obligations, their personal obligations. And they also can start engaging in behaviors that are very risky, doing things that they normally would not engage in if they weren't under the influence of the drug. Now, the third effect is a mental effect, where when someone takes opioids, they can experience delusions, they can experience hallucinations, they can also experience a degree of psychosis. Now, the main opioid that I'm sure everyone is aware of, that is definitely kind of the buzzword, is that opioid fentanyl. Have everyone heard of that word? And I want to provide you with some information about what fentanyl is, but I also want to make sure I provide you with information about what fentanyl is not, all right? Now, fentanyl is a very powerful opioid that is approved by the Food and Drug Administration. It is manufactured by pharmaceutical companies to treat severe pain. And specifically pain that someone might have with, let's say, end-of-life advanced stage cancer. When fentanyl is prescribed appropriately, when fentanyl is taken appropriately, it is a relatively safe drug. And the reason why I think it's important that we have that perspective is that there are individuals who are at end of life. They have end-stage cancer, and in order for them to be able to transition to whatever comes next for them, their pain needs to be managed. And I think oftentimes those individuals feel shamed by the fact that they need fentanyl to be able to manage their pain. But the problem is that the illicit drug industry has also learned how to manufacture fentanyl. They make it in the form of counterfeit tablets, pills, lozenges, liquid, and they even make it in the form of colored candy. They also use it to add to other drugs. So they add it as a contaminant to other drugs like heroin, cocaine, methamphetamine. Because when they add it to these other drugs, it boosts the euphoric effect of those drugs. So methamphetamine triggers the release of dopamine. Heroin triggers the release of dopamine. When you add fentanyl to it, which also causes a dopamine release, the individual is going to experience a more euphoric effect. But they also add it as a contaminant to these other drugs because fentanyl is a relatively cheap drug to make. So they can add a little less methamphetamine in their product and add a little bit more fentanyl in their products. Now, because fentanyl is an opioid, it's going to behave like an opioid, right? All right, so opioids do what? They alleviate pain, right? What are some other effects of opioids that I've talked about? So they alleviate pain, what else? Euphoria, so it's going to have a euphoric effect, what else? Drowsiness.
Shallow dreaming.
Exactly. So it's because it's like an opioid, it's going to have all those effects. A sedative property, a pain relieving property, a euphoric property. But like other opioids, it will also impact one's ability to breathe. It will slow or stop one's breathing down. So this is the problem. Fentanyl is on a different scale than these other drugs, right? So when you hear the drug heroin, you're like, that's some bad stuff, right? Well, fentanyl is 50 times more powerful than heroin. When you think about morphine, I always kind of envision somebody like in the ICU with severe pain with an IV drip of morphine, right? Because we think of morphine as a really strong drug. Do you mind closing that door?
Yes, I hear you.
Thank you. And fentanyl is like 100 times more powerful than morphine. So if we think about that, 50 times more powerful than heroin, 100 times more powerful than morphine, on that scale, it's going to cause rapid respiratory depression. It's going to cause the inability for the individual to breathe. And that's what causes an overdose. Now, when we take a look at how sophisticated the illicit drug industry is, they, when we, 30 some years ago, 20 years ago, most drugs were like, had a degree of purity to it. If you got cocaine, you knew you were getting cocaine. If you got heroin, you knew you were getting heroin. But right now, the drug supply is so contaminated that these drugs are not unisubstance, they are polysubstance. They have a whole bunch of stuff in them. About a year ago, I was in Portland, Oregon, and across from the hotel room was this billboard. And I had to take a photo of it because it really captured the messaging that we need to have around the drug supply. Is that we need to let our children know, we need to let our friends know, our family members know, the clients that we serve, that they need to expect fentanyl. Because fentanyl is showing up in most drugs. There's a lab, and I'm not sure if anyone's heard of it, it's called the Opioid Lab. It's run out of the University of North Carolina, also in affiliation with the University of Kentucky and University of Florida. And they will test anonymously the street drug supply. So individuals can submit their samples anonymously, and then they will run a test to see what the sample contains. Well, they received a sample in February this year, and it was labeled, I think it's fentanyl. Well, when they ran the test of it, and then they report this back out into the community through an anonymous code, they found that it contained fentanyl, methamphetamine, Tylenol, Benadryl, MSM, which is used to, it looks like a powder that resembles other drugs. It sometimes is in joint medication. It contained local anesthetic, like what I would administer as a dentist. It contained also UV plasticizer, things to help, like what they put in windshield, to help, okay? So that was just like, and the person thought it was fentanyl. So it had fentanyl, it had all this other stuff in it. So the drug supply is no longer a drug supply that has a degree of purity to it. It's highly adulterated, it's highly contaminated. And so that's a messaging that we need to start making sure that we send out to the people in our lives who may be using drugs, and especially from a preventative aspect, we start making sure that our children know this. The drug industry is also becoming very savvy in how they are marketing the drugs. Before, years ago, it would be the person on the street corner. But now they're utilizing social media, platforms like TikTok, Snapchat, Instagram. Because these social media platforms are fairly unregulated, and also the messages disappear, so they're very hard to trace. We have this emoji code that was put out in 2022 by the Drug Enforcement Administration, and we have it out on our table. And it really was issued by the DEA to alert parents of the emojis that are used to communicate drug transactions on e-commerce platforms. So if you are a parent and you have children, and your children have a cell phone, you need to make sure you know what's on your child's cell phone, okay? Because our young people are specifically being targeted, and they have a degree of naivety because they don't understand that what is being sold on these e-commerce platforms were not made by Johnson & Johnson or Bayer Pharmaceuticals. It was made by a couple people who rented an Airbnb, who got some chemicals, shipped to them and are putting unknown quantities of these drugs into a pill. One pill might have a lethal dose of fentanyl. The next pill from the same batch may have an unlethal dose of fentanyl. They're putting it together in a scrambled manner. So think about how many of you guys like to bake? Like I love to bake. Okay? You guys like to bake chocolate chip cookies? Now, do all your chocolate chip cookies have 12 chocolate chips in them? Right? I mean, I don't really like the ones that just have one, right? But when you make chocolate chip cookies, right, there's some that have like 5, some that might have 12, some that might have 2. Well, that's kind of what the drug supply is like. There's some pills that have a lethal dose, some that don't, and no one really knows because they all look the same, all right? So the emoji guide, we have it outside. You also can go onto the DA's website and just type in emoji code. So it's really important that you are educated about how our young people are being marketed and targeted by drug dealers on social media platforms. When we take a look at the sophistication of the drug industry, this is about what they're able to produce. So we take a look at a real oxycodone. An oxycodone, once again, it's an opioid. And we take a look at the top one, which is the real one made by a pharmaceutical company. And then you take a look at the bottom one. The bottom one actually looks quite better. Right? Okay? If you take a look at the Xanax bar, Xanax is a medication that, when used appropriately, helps to minimize anxiety, but is highly abused and misused. If you take a look at the real Xanax bar compared to the fake Xanax bar actually looks a lot better, doesn't it? And then if you take a look at Adderall, Adderall is a stimulant that is prescribed to treat attention deficit disorders, but it's also highly misused. The only difference here is the number, right? You know, the real one has a 20, the fake one has a 30. But if you're not looking at it with that degree of detail, you wouldn't know. So it's important, once again, that we start communicating these messages to our family members, all right? So now that we got a foundation, you feel that you understand what opioids are.
Yes.
Okay? And you feel you understand the why. Okay? So let's talk about how you would recognize someone who might be experiencing an overdose associated with an opioid. Now, I know you all know when we hear the word overdose, we know we're talking about a medical emergency, right? And an overdose is when a drug or a combination of drugs exceeds the body's ability to handle, and specifically the brain, where the brain can no longer do its job. So the brain can no longer regulate body temperature. The brain can no longer regulate our state of consciousness. The brain can no longer tell the lungs to expand and fill with oxygen. And the brain can no longer tell the heart to maintain a rhythm. Now, an overdose is something that can occur with first-time use. It also can occur with repeated use. Overdoses can be fatal, but they also can be non-fatal. And really what differentiates between someone surviving and dying of an overdose is the response time. Now, before I go into the response time, there are other factors that can differentiate surviving and dying. So for example, things relative to the drug. What type of drugs were consumed? How strong were the drugs, or the combination of drugs? How were the drugs taken? Were they smoked, snorted, injected, swallowed? And then there are individuals relative to, the individual themselves. How healthy was the individual? Did the individual have any tolerance? But probably the biggest differentiator between surviving and dying of an overdose is the response time. Now, the brain is kind of like, we know the brain kind of controls everything, right? The brain's like the computer chip of our body. But the brain's also kind of the diva of our body, right? Now, when we hear that word diva, probably somebody comes to your mind, right? I mean, probably when I say the word diva to my kid, they're thinking mommy, right? Right? Because a diva is someone, right, who wants things a certain way. And when things aren't a certain way, they have a fit. All right? Yeah. I'm hearing background noise. I hear your thoughts right now. So the brain is just like that. Okay, so the brain only occupies 2% of the body's total weight. but it requires 20% of the body's oxygen. Now that's a diva, right? The brain, when it doesn't get oxygen, for the first 3 minutes, there'll be some mental confusion, some cognitive impairments. Between 3 and 6 minutes, the brain cells begin to die, and you start experiencing mild brain damage. Between 6 and 9 minutes, severe brain damage occurs, it's irreversible. And from 9 minutes on, from about 9 minutes to about 11 minutes, loss of life becomes inevitable. So it is a matter of minutes. And that is what differentiates someone surviving and dying, is the response time of someone being able to recognize that someone's experiencing an overdose, and then being able to respond to the administration of naloxone. Now, if someone's experiencing an overdose, they may exhibit some or all of these symptoms. And they're easy to remember by remembering the acronym BLUE. Okay? Now, how many of you are still watching Grey's Anatomy? Okay. How many of you love like medical shows where people are running through the corridor and they're like code blue, right? And when you hear code blue, it doesn't mean let's all go to the cafeteria and get coffee, right? Right? So code blue means that someone needs to be resuscitated. And that's exactly what happens when someone is experiencing an overdose. So the BLUE acronym is something for you to easily remember. So B stands for breathing. The breathing has slowed down or stopped. L stands for lips. The lips, as well as the nail beds, are turning blue. Because when the blood is deprived of oxygen, it turns dark in color. U stands for unresponsive. The individual is not responding to physical or verbal stimulation. And E stands for eyes. The center of the eyes, the pupils, become very, very small. All right? So I'm going to test you on this. B stands for breathing. Okay? So when you put your ear against their mouth, you're not feeling the warmth exchange of air. You're not seeing their chest rise and fall. L stands for lips. The lips are turning blue. U, hey, are you okay? You're tapping your shoulder, calling your name. There's no response. And then E stands for eyes. The center of the eyes are pinpoints. All right? So if we come across this scene, you need to administer naloxone. So I'm going to walk you through the steps to take to administer naloxone, but I want you to first understand how naloxone works. Is that okay? Okay. Now, remind me of the effects of opioids. Give me a couple effects of opioids. When someone gets an opioid, they're going to experience what? Euphoria. What else? Drowsiness. What else? Shallow breathing. What else? I'm a dentist. Why would I prescribe opioids? Pain relief. Okay. In order for an individual to experience those effects, okay, the opioid has to find a specific receptor and attach it to itself. So think about if you have a drawer of keys. The keys only work in one lock, right? And so opioids have to find a specific receptor that's located throughout the body. Once it binds to that receptor, it then causes pain relief. It causes the euphoric feeling. It slows down the breathing, all right? Now when you spray naloxone in someone's nose, naloxone does two things. It physically rips the opioid off of its receptor. It causes a detachment. And when the opioid is removed from its receptor, guess what happens? There's no more pain relief. Breathing resumes. Someone's not feeling euphoric anymore, right? So the effects go away. But the other thing that naloxone does, it then attaches to the receptor. And when it attaches to the receptor, it has no opioid effect, but it blocks any circulating opioids from reattaching. Does that make sense? So it has a removal and a block mechanism. Now each box of naloxone, and hopefully there's some naloxone, just kind of walk up the street. Make sure you leave here with a free box of naloxone. But each box of naloxone comes with 2 of these nasal sprays, which I'll explain to you in a second. And because naloxone is specific for an opioid receptor, it only reverses an overdose that involves an opioid. So if someone is overdosing, let's say from alcohol or methamphetamine, naloxone will have no effect. It only works at the opioid receptor site. Does that make sense? Okay. It can restore breathing. It binds to the receptor for about 30 to 90 minutes. And after that period of time, it can fall off. Now, why is that important?
Can you use again?
Well, if someone still has a lot of opioids, opioids can stay in your system for a couple of hours. If someone still has a lot of opioids in their system, and now you have opioid receptors that are no longer occupied, they can bind to the receptor and another overdose can happen. So that's why it's really important that that individual not only receive naloxone, but they be transported to an emergency department where they can be monitored until there is some degree of assurance that their system is clear of opioids. Oftentimes, paramedics will start an IV drip of naloxone on them, so there's a continual exposure to naloxone. Are you guys following me? Okay. Now you can, naloxone in 2023 was approved for over-the-counter sales. So, you can get ibuprofen over the counter, you can get Tylenol over the counter. It doesn't require a prescription. You get naloxone over the counter. It's not a controlled substance. It has no opioid effects. It's not causing euphoria, pleasure, pain relief, any of those things. And it's safe for children. So you can go to Safeway and you can purchase naloxone. Once again, we have it for free, just up the road a little bit. Okay? Now each box contains 2 of these nasal sprays. Each spray will deliver 4 milligrams of naloxone. So once you press the button, you have emptied out the nasal spray. So this is not like, when you take allergy medications and they say, prime it for a little bit in the air. If you press on it, you've emptied it out. So it's already ready to use. You don't need to prime it. It will administer 4 milligrams of naloxone, which is the recommended dose of this medication. Now, there are, with any medication, any drug, there will always be some kind of side effects, all right? So think about what's going to happen now if you have removed the opioid off of this receptor. How is that patient going to feel? You took their high away, right? So are they going to go from not being in pain to being in pain, right? They're going to go from not breathing to they're going to go from having a cozy, warm feeling to
Wanting to fight.
possibly sometimes. So they're going to have some withdrawal effects. They may experience nausea and vomiting. They may have diarrhea. They may have a fever. They may have a cold sweat. Their heart rate may increase. And it's interesting because I spoke recently to someone who is like a supervisor for the paramedics in San Mateo County. And one of the things that always comes up is, are they going to wake up really kind of combative and wanting to fight you and really irritated? And he said that's actually not what we typically see. We typically see that when someone becomes responsive to naloxone, they regain consciousness. It's almost like they came out of amnesia, like they're dazed and confused because they lost moments of time. Their breathing slowly stopped without their awareness. And now they're waking up to something that's a fairly chaotic scene. Paramedics are arriving, you've administered naloxone, there's a crowd. So they wind up typically coming through a little bit more dazed and confused. The other thing is because it's a nasal spray and it's coming in through the nose and being absorbed through the nose, it's less of a going from 0 to 100 than if people would inject them with naloxone. So it's more of a kind of slow coming to. Other side effects might be nasal swelling, congestion, runny nose, increase in heart rate, increase in blood pressure. But I do want to assure you that these side effects are so much minimal compared to the ability to save someone's life. So the benefit far outsees the risk. So I'd like to kind of walk you through in real time how to respond to an overdose. So can you guys still hear me?
Yeah.
All right, so let's just say we've come across a situation and going straight and someone's kind of slumped over, you're not really sure what's going on. There might be some environmental clues, right? You might see drug paraphernalia, you might see needles, you might have some clues based upon the environment, or you may not know. But the first thing that you want to do is always determine the level of consciousness. Hey, are you okay? Are you okay? So I'm using my voice, I'm tapping their shoulder. You also can pinch their earlobe. You pinch your earlobe, that way you don't feel away. Okay? You also can take your fist and you can do what's done in the sternal rub. You run it right down the center of your chest, and that also is very stimulating. You also want to see if you're noticing a sign of blue. Are you noticing maybe some breathing challenges? Okay? So when I'm going to now put the person gently on their back. And the reason why you want to put them on their back is one, it provides you with a higher degree of visibility to their entire system. It also helps to start opening up their airway. It also prepares them to be preceded if required CPR, right? So you gently put them on their back, and you're going to be testing, like, are you feeling the warmth of air exchange? Are you seeing their chest rise and fall? So I'm not seeing any of those things. So now, and let's just say I'm by myself, all right? Next slide. The naloxone comes, each box contains 2 of these, and they are both individually packaged in that box. You're going to see on the paper back, it will say peel here, allowing you to open up your nasal spray. And you want to locate the plunger. The plunger is what goes into their nose. This is the nozzle. The nozzle goes in their nose. This is the plunger. You want to put your index finger and your middle finger on either side of the nozzle. You want to put your thumb on the plunger. Okay? You want to tilt your head back. Once again, it's going to open up their airway. And you also want to support your neck. So with one hand, you're going to do both of those things. You're going to insert the nozzle. I'm going to do this so you can see. Insert the nozzle into their nose, and you're going to insert it as far until your index finger and your middle finger are at the base of their nose. Alright? And then you're going to press the plunger, and that will dispense 4 milligrams of naloxone. Then you're going to remove the nasal spray from the nostril. If you're by yourself, you are going to administer naloxone first, and then you're going to call 911. Now tell me, why would you do that in that order? Timing. Timing. You're trying to get the opioid off its receptors, get the breathing to resume. Now, if you are with somebody else, okay, let's say you are eating dinner at a restaurant and you're with somebody else, you're going to say, hey, call 911 while you are administering the naloxone. Okay, so these steps will happen simultaneously, right? But when you do call 911, you want to be very clear. You want to say, I think somebody has overdosed. Now, when you call 911, keep them on the phone. And the reason why I say that is sometimes everyone responds very differently in an emergency, right? How many of you get called when there's an emergency? I get really calm, because I had to. I couldn't freak out till no. Like, oh my God. Yeah, right? So a lot of us panic, right? And so, and sometimes you're like, oh, I called 911 on the phone. No, 911 is your lifeline. They're going to start talking to you. They're going to be saying, hey, make sure that there's access to the door. Have you administered the naloxone? You want to give them as much information as possible. They'll tell you the paramedics are en route. They're 1 minute out. It's very, very reassuring. So you keep them on the phone. Go back. Okay. You want to, if you are trained in CPR, you want to determine if the individual has a pulse. If there's no pulse, you want to start with chest compressions, and for those of you who are trained. If there is a pulse, then you want to provide rescue breathing. Once again, if you're trained and comfortable, you're going to administer 1 breath every 5 to 6 seconds. But the most important thing is calling 911 and administering naloxone. Right? The CDC did a study, and they found that when the bystander did absolutely nothing, they didn't call 911, they didn't administer naloxone, 70% of individuals will die. Right? So doing something. If you don't feel like doing rescue breathing, you're not sure about the CPR, fine. Call 911 and administer naloxone. If you don't comfortable administering naloxone, call 911. But doing something is going to be better than nothing. Doing nothing is predicted as so-and-so. Right? And that's fine. Now, how do you know it's working? You know that it's working if in 2 or 3 minutes you have a reversal of the blue. So that means B, breathing has what? Resume. You're seeing your chest rise and fall. L, the lips are starting to turn the normal color. U, they're going from unresponsive to responsive. And E, the pupils, the center of their eye, are starting to return to a normal color. Okay? Excellent. When you see that in 2 or 3 minutes, you're still going to stay there with the individual. You still are going to have paramedics en route. You're going to stay until the paramedics do the kind of transfer of power, if you will. But you want to turn the individual on their side in a recovery position. And ideally, you want to have them turn towards you. Why would you want them towards you? Okay, so you want them on their side because one of the side effects is they could vomit, and you want the vomit to go out and not in. If it winds up going to their lungs, you're dealing with another medical emergency, right? So by having them on their side, it allows it to exit, but also you want to keep their eyes open. Because even though the lockdown has worked, they could, within minutes, go back into a state of unconsciousness. So you want to be able to have full visual view of who this individual is and what they're experiencing, okay? You know it's not working if the person is still blue. So they still, breathing is still shallow or active. The lips are still a purple color. They are not responding to visual, verbal, physical stimulation, and their eyes are still small in size. If they are not responding in 2 or 3 minutes, you are going to administer another dose of naloxone to the other nostril. So once again, tilting the head back, supporting their neck, putting the nozzle to the nose, and administering. You are going to continue this sequence, this cycle, until paramedics arrive. Paramedics are oftentimes having to administer like 8 or 9. Okay? It's not going to happen in your response time because paramedics will have been on the scene, but multiple administrations of naloxone likely will need to, are required because these drugs on the street are incredibly powerful. So you remember it's a matter of time. You're trying to get oxygen to the brain. All right, is that clear? Okay, next slide. So you're going to continue to re-administer every 2 or 3 minutes until, and perform your CPR, until the person responds or the paramedics arrive on the scene. Next one. And then once you're all done, you can throw away the naloxone in a trash receptacle, ideally away from kids, because kids will see this and think it's a toy. And even though there's no more medication in it, there could be fentanyl around it. Okay. All right. Okay. So let's talk about many of you probably may not have medical knowledge or medical background, but it's important to understand that throughout this country, we are encouraging bystanders to respond to overdose deaths. I shared with you on that very first slide kind of the why. We went from 110,000 overdose deaths in 2023 to 80,000 in 2024, 27% increase. And it's widely believed because we now have Good Samaritan laws where bystanders can administer naloxone without civil liability, which means that if you administer naloxone to someone that you suspect is experiencing an overdose, and you do it with good judgment, you are not subject to civil liability. The only time that you would be subjected to any type of liability if you are grossly negligent and incredibly reckless, like you gave someone naloxone through the middle of a street on ongoing traffic, right? But what was that?
I say if he stands up and gets run over.
Something that's really negligent. But it's really believed that the decrease that we're experiencing is due to the administration of naloxone and also these Good Samaritan laws that not are only here in California, but are enacted in most states throughout this country, encouraging bystanders to participate and be involved. All right, so where can you get naloxone? As I said, you just kind of go up the Yellow Brick Road. There is a booth, and I hope that everybody leaves here with naloxone. You need to make sure that it is in your first aid kit at home. I have it in my kid's backpack. You want to have it in the trunk of your car because you never know when it's going to happen. It can happen in a comedy club that you might be at. It can happen in a restaurant. It can happen in a parking lot. It can happen in your home. You want to be able to respond. There is a vending machine at the McGuire Correctional Facility. It's in the lobby for free naloxone. The Behavioral Health Recovery Service Center in San Mateo County, we are putting up 8 vending machines in our clinics, and those should roll out this fall. Naloxone sandboxes are, thanks to the HOPE organization, are located at the LIT Cannabis Dispensary, the Longboard Bar, Fog Zone, and the Pacifica Resource Center. And so this is free. These are free resources. If you are inclined to pay for it, you can always go to retail pharmacy, Safeway, Walgreens, Walmart. You can get it on Amazon. It does not require a prescription. So, how can you get involved? You can get involved by making sure that you educate other people about what Blue is, right? And how to utilize naloxone. But also you can get involved because as a county, we are building an overdose prevention coalition where we want to engage the different aspects of our diverse San Mateo community to collectively and cohesively and collaboratively respond to overdoses. We want to reduce overdoses in the county. We want to help navigate the complexity of services that are offered here in the county, and we want to prevent one more person from dying from an overdose.